Providence St. Joseph Health is a national not-for-profit driven by a belief that health is a human right and is committed to innovating to improve care for all, especially the poor and vulnerable. Learn more at future.psjhealth.org.
What do we do? What are the ethics if I understand something about your genome that predicts that you're going to have Alzheimer's in 5 years? Do I tell you? Do I not?
We're starting to see healthcare move beyond the four walls of the hospital.
Just go over to your 3D printer and print out the drug that you need.
In 2050, I get customized medications tailored to my molecular genetic makeup.
How will the system bear these costs?
What it has done is it has brought the C word, cure, into the dialogue of cancer.
Welcome back to The Future of X, a podcast from OZY that vaults you forward 50 years to the year 2069. Each season, we take one area of your everyday life, from food to dating to cryptocurrency and sleep, and find out what it will look like in the decades to come. We go beyond the technological advancements and dig into how our lives are going to be changed in often exciting, sometimes frightening ways. I'm your host, Carlos Watson, editor-in-chief of OZY. Our first season, in partnership with Providence St. Joseph Health, looks into something that touches us all, the future of health. On today's special bonus episode, we sit down with two leaders from the world of healthcare to hear about their visions of the future, including their biggest fears. We speak with Debra Canales, Executive Vice President and Chief Administrative Officer at Providence St. Joseph Health, a nationwide not-for-profit health system worth more than $25 billion. She's a part of the majority female senior leadership team, a rarity in the healthcare sector and beyond. Debra bravely opens up to us about her personal story of Me Too, the role of women in the future of healthcare, and a theme that just keeps coming up, the importance of humanity in a tech-focused future. But first, we speak with Rod Hochman, the president and CEO of PSJH. Rod tells us about what the past means for the future of health and some of the ethical questions that surround the groundbreaking advances ahead. I wanted to start at the top. I still love the story about how Providence St. Joseph Health came to be, which I think a lot of people don't know. Do you mind sharing that backstory a little bit?
Oh, absolutely. When I'm talking to other people, the first question I have for them when they're inquiring about our organization is, can you name a company or organization that's over 165 years old, that is now valued at over $25 billion, that was started by a group of women? And that usually gets their attention. We had a group of women that came from Montreal, literally landed in Vancouver, Washington, and basically started schools and hospitals that eventually populated the West from Alaska all the way to California. And for Providence St. Joseph, the St. Joseph sisters in a similar way landed in Orange County in Eureka, California, and just rolled up their sleeves and started in taking care of people. They didn't worry about whether the health care was covered or not or anything else, and they did what they needed to do. So we feel a sense of heritage and tradition, and the guiding concept of the health system was always to care for the most poor and vulnerable people in a community. And that commitment has lived for over 165 years and is still present today.
Rod, how did they fund it in the early days? I mean, I can imagine how daunting the challenge would be even today. But 165 years ago, women in pioneering California or women in Montreal, Canada, trying to take care of the poor and needy, where'd they get the money from? How'd they make it work?
So when they were out west, they did what they call the begging tours, which was our equivalent in this modern day of fundraising. We have some great pictures of the sisters in full habit on horseback going to mining villages. And typically, they were smart enough to know when all the miners got paid. So they'd go there before they got to the bar. They'd make sure that they approached them and got the donations. So they really just carved it out and built it on donations from the miners and the settlers that were there. and built it off of that.
Rod, that's actually a perfect transition to kind of talk a little bit about the future and where you see the future of health going. If you were to help folks jump ahead 10, 20, 30, even 50 years, what do you think are going to be some of the most interesting changes we'll see in healthcare and medicine?
What used to happen with healthcare, originally it was centered pretty much around the doctor. Today, healthcare is more centered around the individual and the family. And they want care wherever they are. So care in the future is going to happen more in the home where the individual is, and it'll happen over devices, it'll happen through telehealth, it'll happen virtually as much as it does sitting in someone's office. The other thing that'll happen is, I think we'll see, we believe that everyone deserves a health coach in their life. So they'll have all their data readily at hand, and as you and I are talking today, we'll be able to look at our iPhones and look at what our health status is during that day, what we did, what we ate, how it fits in, did we take our medication, kind of keeping us on track virtually on a 24/7 basis. The predictive ability to understand what types of illnesses and things we're susceptible to are going to be things that are going to be pre-programmed for us, so we can maintain our health instead of waiting for the next illness to hit us as we come forward.
Rod, when you think about some of the things that don't excite you but instead maybe frankly scare you or worry you about the future of health, what's on that list?
Well, I think first of all, in the era that we live in, we have a lot of people necessarily making health policy that really don't understand health care. I think sometimes you have to actually ask the people that do the work to help design the system. So that's kind of scary. The second is, the flow of information. Who controls it? Where is it? Is also something that I think people worry about. Their health information is probably the most sacred information they have. And in this era of Facebook and everything else, they're concerned, where is their health information? So I think that's a fear for everyone. And I see part of our role as a health organization is to help protect our patients' health information and make sure it's used for the right reasons and that people have control over that information.
Rod, blow our minds a little bit about some of the things that are coming up ahead that you've either talked about or heard about.
So I'd say one is the dense data clouds of information about our health, that once you put all of that information that comes from your genetic code, from your biome, from all of the data that's accumulated off of devices and all of those things, we can sometimes predict absolutely what's going to happen to us as we go forward. So that, to me, is going to be something that is going to make a tremendous difference in the predictive nature of healthcare. And that in the future, what we take for medicines are going to be medicines that are directed towards what we say an N of one, towards each individual, so that the medicine that I might take for a disorder is going to be individualized to me, and the medicine that you might need for the same disorder will be individualized to yourself, so that they're effective for each one of us.
Rod, the idea behind personalization is powerful, but I know that one of the flip sides of that is this notion that Vivek Murthy and others talk about in terms of loneliness. And I know you often think a lot about whole care, including mental health. Do you want to talk a little bit about where you think we can go from here? Are there big, bold opportunities, not only around physical medicine, but if you will, around our mental health as well?
Oh, absolutely. And, for us, we try not to separate the two because we think mental health and physical health are inexorably intertwined. There's data that shows that of people who have physical illness, more than 40% of them also have a subsequent mental or behavioral health issue going on at the same time. The things that we're concerned about, and we have a big movement around mental health because we feel it's the epidemic that's out there. So as we talk about opioid addiction, when we talk about depression and the suicide rate, it's reaching epidemic proportions, and it needs to be treated as aggressively as we would a virus or any other illness. So part of what we're trying to do is relieve the stigma of mental illness so that we think about it the same way we think about having cancer or we think about having an infection. And then part of what we're understanding is that so much of mental illness is related to resiliency. And that, when we live in a society that's isolated, it exacerbates a lot of the mental illness that we see. And we see some of the unfortunate products of that in society today.
Rod, I want to tackle the question of ethics in medicine, because as much change and innovation is coming, it'll also raise lots of big ethical questions. And you put your finger on one of them, which is privacy, but that's only one of them. What are some of the other big ethical debates that you expect that we'll be having over the next 10, 20, 30 years as health and medicine evolves?
Well, it's going to be the issue around artificial intelligence. Artificial intelligence is changing the way we do healthcare, and it's now coming at an accelerated phase. And there's a whole ethics about artificial intelligence, how it's used, how do we apply it to individuals' health, but also how do we apply it to the workforce. There are some predictions just that, probably as many as 6 or 7 in 10 jobs could be affected by the use of what we call AI or artificial intelligence. So that's going to be a critical aspect. What do we do? What are the ethics if I understand something about your genome that predicts that you're going to have Alzheimer's in 5 years? Do I tell you? Do I not? What do we do with that information? It's also, what are the ethics of how we deal with information that we find out about patients, which in general we have always felt that patients and individuals have a right to all their information, but maybe sometimes they just don't want to know about what may happen to them.
Rod, I'm going to finish off here with a lightning round, super quick questions. Question number 1, would you want to know that you had dementia?
Absolutely.
Who's your hero?
My hero is my dad and mom.
Favorite book?
The Boys in the Boat.
And final question, if you were not running and helping to build and grow PSJH, what would you love to do?
What I do is I'd go out in the world and help populations that are poor and vulnerable in other ways. As a lot of people have talked about, David Brooks has talked about in his book, I'm more concerned about what my eulogy is going to be than my resume.
It's more important than ever to let lessons from the past guide us to a fairer, more thoughtful future, whether it's in providing health education to the community, preventing illness, prioritizing mental health, or empowering female managers. Up next, we speak with Debra Canales, Executive VP at Providence St. Joseph Health, about her personal journey to become a leader in the industry and her vision of the future. Stay tuned for more The Future of X. Health goes beyond the hospital. A child can't learn if he doesn't get breakfast. A mother with depression can't parent well without mental health care. An elderly person can't be well without adequate nutrition. No one can heal if they can't access health care. This episode is brought to you by Providence St. Joseph Health, a national not-for-profit health system driven by the belief that health is a human right. Learn how Providence St. Joseph Health is innovating to improve care for all and address the social factors that affect health. Visit future.psjhealth.org. Debra Canales is responsible for human resources and community ministry at Providence St. Joseph Health. She was named a Modern Healthcare Top 25 Minority Leader in 2018 and helped start the #NotHere movement at PSJH, meaning zero tolerance for harassment or discrimination. It's their response to the Me Too movement. And it was Debra's personal story that led her to speak out. It was interesting in your bio, I read that you were called to Providence, and I love that. As the grandson of Baptist ministers, you sometimes see that in other settings. What has spoken to you about the work you've done?
The sisters, I just came back from Montreal where we celebrated 175-year blessings of our Sisters of Providence. And one of the sisters reflected, I was called to be a sister because I want to live my life with zeal. And they define zeal as love on fire. And when I think about what really transformed my call from for-profit into faith-based and not-for-profit organization, it's exactly that expression.
When you think about how Providence St. Joseph Health is evolving and you think broadly about how it needs to evolve, talk to me a little bit about that.
Yeah, the constant challenge of living and serving during tension and constant change and really reading the signs of times and being very deeply rooted beyond just the medical aspects and beyond just the bricks and mortars of a hospital, but really extending that into the communities and to really think about the impact of health and well-being outside these clinical settings that really look at all the social determinants of health, housing and nutrition and education, transportation, even safety. And I think for the future, we're moving in such an era of consumerism and digital and technology. And I think if the sisters were to call it today, they would shift our thinking from information technology to inspiration technology.
One of the interesting things, Deb, I know that you've weighed in on before is this notion, what will happen as the gender balance in healthcare changes? I think something like 70% of the global healthcare workforce is made up by women, but maybe less than 30% of women are in leadership positions. How do you think things would change if more women were in leadership positions over the next 50 years?
I was reading a McKinsey report back in 2017 that looked at top performing organizations versus bottom performing companies. And the evidence is compelling. I mean, 5 times the level of faster promotion rates for women across the pipeline, 2 times women in the C-suite, or as you talked about that, percentage being less than 20% of representation, but really moving that forward. More than 80% of women as managers, and also men committed to gender diversity and creating that awareness. And it's just having those voices and having an inclusive and diverse voice as we make decisions and things that we may not, consider. One could be as we look at our focus on parents of our that are our caregivers today, and how do we develop services that help our working parents. And so when we have different perspectives, those things really help to shape what do we have to do different in our work environment to help our caregivers thrive and be able to follow their calling.
Talk to me a little bit about the Me Too movement. I think, as I understand it, within PSJH, you helped start something called #NotHere as kind of a response to the Me Too movement. Tell me more about that. What was that about, and what were you hoping would come out of that?
It's paying homage to the founding sisters that said we take care of every caregiver. And so that's why we say not here, because we don't tolerate harassment or abuse of any kind. Part of that is then how do you integrate that into all of our systems and policies so that people can respond when they have issues anonymously or to their supervisor or to anyone.
And Deb, have you had personal experience with Me Too moments?
Yeah, so I was married right after college and started to recognize some things that were very different after getting married and being of Catholic faith and really committed to my marriage. Really thought I could work things out and did not complain, did not engage in others, and the marriage continued to get more abusive, both verbally and physically, and it really wasn't safe as I was in some pretty significant Fortune companies where I had to really perform, and that having an issue with my marriage was going to hold me back, and so really did everything to try to work things through and did not confide in anyone, including my parents. And so when I moved into faith-based healthcare, I spent some time talking with a nun, and I shared with her confidentially my story, and she said, you know, God would not want anyone to live and a life that you're living, and that it's okay to make whatever decisions you decide. And so for about a year, I called them my angel squad, and I engaged about 6 women who really had similar experiences and helped to pay it forward to me and help me escape. And I literally had to escape out of my marriage, and filed the divorce. I had a personal protection order in place. I had security. It was very scary, and successfully got out of the marriage. And unfortunately, my ex died a year after. And through those lessons, it's the gift that God has given me is as part of a different life, and wanting to help pay that to other women who are maybe experiencing some of the same things I've experienced, and to let them know that it's safe to confide in others, and that there is a way out, and just to have those conversations. And I feel that that's part of my calling now, is telling my story, getting it out there, and helping to inspire and to give strength and to give courage as part of my voice to all. So, it's still kind of tender for me, even talking about it today, and how much the work that I'm doing to help create that freedom. If I can help change and shift the thinking of one woman, then I know I've made a difference.
What could someone have gone back in time and said to you even earlier that would have helped move you? Because I really relate to what you're saying. I was with a family member recently who, like you, was in a high-performing situation, wasn't really able to confide about a difficult marriage for a variety of reasons. And I was surprised later on and wondered what, if anything, I or others should have seen, could have done, could have said that could have led to more open communication sooner. So as you look back, and maybe the answer is nothing, is there anything that someone could have done, or that somehow someone could have been helpful to you in the course of that marriage?
Yes, thank you. It's a great question. I think the biggest aha for me was just asking for help. And that's just not part of the DNA that is part of that high performer, or the person I was, 20 years ago. And I think as leaders, how do we recognize that in our own people? And what I try to do whenever I'm conducting my one-on-ones with my team is always asking at the end of my conversation is, how can I support you? And many times my team will say, oh, there's nothing, I don't need any help. And I keep asking the question 2, 3, even 4 times until I get an answer. And sometimes that will help break through maybe some of that tentativeness or fear, and to really then engage in a deeper conversation of what's going on.
And you were so clearly driven by your faith, by your spirituality. I deeply appreciate that. What about for folks who religion and spirituality is not part of how they see the world? How do you think they can hear the urgency for improvements in the health space? How would you communicate to someone for whom the spiritual and the faith-based piece is not really a part of the conversation?
It's well-being. And so how can we be our best selves? How do we bring our best selves to anything? As we look to how we influence, having access, having the water, having nutrition, having housing as part of being able to thrive.
How would you change healthcare day one, what would be the first thing you would do if you really had that kind of broad-reaching power and impact?
Just the simple focus on, the basics, going back to the social determinants of health and, housing, water, food, and just, how do we enable all of our, various constituencies to just really hold up on just the basics and to, help each of our communities, just be able to thrive, to have those elements every day.
Finally, talk to me a little bit about your heroes. Who do you admire? Who stands out for you?
Probably the first one is Mother Teresa. I think about just her voice, and she really wasn't afraid to put it out there and to challenge and not get easily pushed aside, but rather stand firm for her convictions, because she knew what was needed, and she was quick to find solutions to the whole in a very creative way. And it just goes back to our sisters and just their steadfast commitment. And maybe, they received an answer of no, but they kept going back and, until they got what they needed. And I think that's what inspires me when the going gets tough, and just, continuing to think creatively of, okay, what are other alternatives, and what would the sisters have done if they were in this situation? And, the sister said, let me use the metaphor of Janis Joplin, look at her and how she performed. She goes, that is love on fire. And, I want to carry that same spirit in terms of how we extend our mission to everyone we serve every day.
Whether it's love on fire or robots at our doorstep, it's clear that the future of health is full of wonder and fear, and a lot in between. Ethical questions are already being asked about how healthcare companies can avoid the issues that big tech has faced. Terms like genetic discrimination, transhumanism, and maybe even good death will slowly become mainstream. And therein lies the ultimate question. If you could see what your life or death was going to look like in 50 years, good or bad, would you want to? What do you think will be the biggest disruption to health in the decades to come? Send us a note at future@OZY.com, that's future@OZY.com, or tag us on your socials at #FutureOfX. And here are the credits, brought to you from the year 2069. The Future of X is produced by OZY in partnership with Providence St. Joseph Health. Leah Rose, future digital tattoo artist, is our producer. Molly Fosco, future transhuman athlete, and Sean Braswell, future super speed reader, are the editorial producers. The show was edited and mixed by Chris Kim, future gene editor. Rob Kulos, future body farmer, is our executive producer. Tracy Moran, future loneliness scientist, is our deputy editor. And Faye Schlesinger, future sleep-free superhuman, serves as managing editor. I'm Carlos Watson, future Tom Brady, once I get my bionic legs on. For more on the Future of X, go to OZY.com/future, that's OZY.com/future, and look out for season 2 of the Future of X coming soon.